Hi, I'm Dr. Philip McMillan, and I am focused on COVID-19 autoimmunity with regards to both severe COVID as well as long COVID. I am coming back to do this recording largely because there were some issues, technical difficulties with the last recording, and I think that this is so important that I want to capture those thoughts again. So I hope that I'll be able to do it justice with regards to could lockdown be the cause of rising mortality? What really am I talking about with regards to that? What I'm referring to is the fact that when we look at excess deaths in England and Wales, you can see the blue line represents this here, represents COVID 19 deaths. But what's of concern is this area in red above here. And we're going to come back to that in a little bit. But it was because there were a number of news headlines with regards to that. So here you have in the sun the excess deaths in England and Wales, and they're showing that same image. And the critical wording is lockdowns killing more people than COVID 19, as 10,000 excess deaths recorded since June. And so this is what that had referred to. And that caught my attention because I was thinking, why is there the assumption that this is related to lockdown? Not saying that it's not a part of it, but would that be necessarily the main part of it? And again, similarly, here in the Belfast Telegraph, you can see here excess death figures to be examined amid concerns about lockdown effects, just in case you can't see it properly. And again, they're referring to authorities have asked for excess death figures to be examined, as it was reported lockdown effects may be killing more people than COVID 19. And again, I ask the question, where did that thought come from that this was because of lockdowns? So part of what I'm going to be doing here is I'm going to be highlighting a few points with regards to the what could be happening with lockdowns that could be a contributor to this. Additionally, I am going to take on a very important point about the elephant in the room. And the mere fact that I have to mention it in that way, I suspect you know what I'm talking about. And so we'll come back to that in a little bit. But the starting point, could lockdown be the cause of rising mortality? So what I've got here is I've got a paper that focuses just on that exact point. Risk factors for excess deaths during lockdown among older users of secondary care mental health services without confirmed COVID 19. This was a retrospective cohort study. It was published in International Journal of Geriatric Psychiatry in 2021. And so, in effect, what they found in conclusion, I've highlighted here in blue, during lockdown, people with dementia or severe mental illness had a higher risk of death without confirmed COVID 19. And so they found a significant, it was actually 123% risk of death in the cohort of older people with mental health conditions. That makes sense in the sense that if you are older or with already limited mobility, what happens is when you are in a lockdown scenario, you decondition if you're not doing any of your normal activities. And one can see that there are a number of factors around that that could impact an older person, someone with mental health issues, that there could be an increase in mortality in that group. But that's the specific point. It wouldn't explain across the board. This is just in one particular cohort. And so we look further, and I'll talk now about another study that was done in the BMJ. And again, I'll put it on full screen here for you to see. Lockdown and non-COVID 19 deaths caused specific mortality during the first wave of the 2020 pandemic in Norway. And so this paper here was focused on what were the outcomes of death between March to May 2010 to 2020, comparing it, the lockdown period versus normal periods. In conclusion, they found that there was no significant difference in the frequency of major causes of death in the first wave of COVID-19 2020 pandemic compared to Norway. And that would make sense. But let's put in the proviso here. The proviso is that that would have been right after the pandemic started. So you wouldn't necessarily see the lockdown impacts at that period of time. And so, yes, you could see that point being relevant, that lockdown could show later impacts. But again, I would separate it into cohorts of patients and not necessarily just completely across the board. So here is where I come on to what I consider to be the more significant question with regards to excess mortality, because we are talking about the United Kingdom here, but what is happening in other parts of Europe? And when I look at that, I go to the Euromomo graphs and maps. And this here it's the link will be in the description below, so you can go and look at it. But it's covering most of the countries in Europe, including the UK. And what they look at is number of deaths by age group, and they're looking at all ages here. And this is going all the way from 2018 down to 2022. And in the gray bars here, that's the normal range of deaths. The blue is what the deaths are per week. This is why it spikes. The critical thing is the substantial increase here, which is the red line. So you can see here in 2018, there was a substantial increase. I don't know the cause of that. Here is the spike with regards to the COVID-19 pandemic. This was just in March, and then this one here later in the year was another spike. But when we hit 2022, the levels remain above the substantial increase all the way up to our current time. So this is all the way. The excess deaths is 79,983 across Europe. And so that's important. And you have to understand that I flagged this in January 2022 when I first saw the Euromomo data, because I thought that there was a clear signal that suggested that we needed to investigate further. You can't say what the cause is, but when you see a flag, you must try and see if you can clarify that a bit more. And when you see the breakdown here, and again, I'll make it full screen, it's breaking it down into the different age groups. And if you look 0 to 14 years from 2018 all the way along, has largely been in the gray area. However, you can see this upward trend where it actually touches the substantial increase line around there. And similarly, 15 to 44 years, again, is going above the substantial increase. This is just before 2022. It has come down and then it has gone back up again. And so when we look at those figures, those are small flags, and that's across all of Europe. So does it necessarily mean anything? Difficult to say. Well, before I go into any further discussions about the Euromomo data, let's ask the question. So firstly, could excess mortality be caused by lockdowns? Yes, certainly it could be a part of the picture. As we pointed out in older cohorts, people with mental health disorders, there's a significant increase in terms of mortality in that group. But it wouldn't explain a broad correlation with regards to mortality across all the groups. So that's the first thing, that lockdown could be a part of the picture, but it won't be the whole picture. What about COVID complications? Because in the first year and second year, we had significant COVID-19. Many patients were hospitalized. Even if they survived the severe COVID-19, they could have been on intensive care, on the wards, and getting oxygen. They could have had longer term damage to organs, to the kidneys, to the lungs, to the heart. And yes, in a year, they could have increased mortality. And again, that is something that we have to look for. And there is already evidence to show that you have a higher risk of mortality with regards to having significant COVID-19 and organ damage. Would it explain the whole picture? Probably not, but it would certainly be a contributor to it. And then we come to the elephant in the room. Let's take a good look at him. There's an elephant in the room. He's knocking chairs over, but nobody wants to talk about the elephant. That's a problem because science doesn't actually take a look from a political point of view. It just looks at evidence. So the next question we have to ask is, could excess mortality be caused by COVID vaccines? Why wouldn't we ask that question? We have just implemented a strategy using a relatively new technology with a virus that we don't fully understand, and we have applied broadly across the population a vaccine. Now, when you think about that, what we really should be doing is trying to study to see what impacts that could have. That would be the normal scientific perspective. But because of politics, everybody is very afraid to talk about this. So let me give you an example. This is how medicine works. Medicine is nuanced for many things. So I'll give you an example with regards to a condition called atrial fibrillation. That's an irregular heartbeat where the heart can make extra clots, which can then cause strokes. So effectively what we do is we give patients who have atrial fibrillation, usually older patients, blood thinners like warfarin or apixaban or the DOACs, and we use those drugs to thin the blood and reduce the risk of stroke. Perfect sense. The question would be, would we apply that strategy to all patients? The point is no. Medicine knows that we have to be very selective in terms of treating these patients. So we have scoring systems that help to guide us as to which patients to treat, which patients to wait, and you weigh the risk and the benefit. If we applied the use of anticoagulants across the population, there could be so many complications that we would stop using it and not get the benefit for stroke. That's an example where you don't use science to guide and nuance your treatments. In the same way, we could find that indiscriminate use across the population, even in low risk cohorts, could increase complications and therefore make the intervention appear to be less beneficial than it could be. So when we ask the question, could excess mortality be caused by the vaccines? Of course, we have to look at it. We absolutely have to look and talk about the elephant in the room. So that leads me on to the next part of what I want us to focus on. When we look at these slides here, these are still from Euromomo. And what you can see here, I've put in 2019 in yellow, in gray is 2020, in blue it's 2021, and in light blue is 2022. And what this is looking at across all ages, excess deaths. What we can see is that excess deaths in 2022 are about where they were in 2020. Now, isn't that remarkable? How could that be across Europe? But even more concerning, when you break it down by age group, 0 to 14 years, look where 2022 is compared to 2021 and 2020. This is absolutely significant. What is the cause of that? I doubt that would be lockdowns that would kill younger children and adolescents. Similarly, when we look at the group 15 to 44 years, 2022 is again higher than 2021, 2019, and significantly higher than 2019. If you look at this period here, we are at 2,565 excess deaths compared to 460 in 2019. You can understand in 2020 when we had the pandemic, and I guess to some extent Delta in 2021, but what's the explanation in 2022 when we have Omicron? We have much lower numbers with regards to this for the 45 to 64-year-olds, and that's good news. And is that trending to suggest that the older age groups should be more targeted with regards to using interventions to reduce the risk of severe COVID-19? That's what I mean about nuances in the context of medicine. Very rarely do we do anything across the board because there are always adverse effects. And adverse effects are part of medicine. Everything is about mitigating those adverse effects, reducing risks, and selecting the most appropriate interventions. When we look at deaths in terms of COVID 19 here, and I'll make this again a bit larger, this has been relatively static. It's going up a bit towards the end here, but it's just undulating along. So, similar to what we see here, these deaths are relatively flat, but something is causing these non COVID deaths. And that's the bit that we need to clarify. That's what we need to focus on. And so when we look at vaccinations as a group, and it's very concerning that we feel there is an anxiety about making any discussion about vaccines, even from a scientific perspective. And that is very, very worrying because we need to be able to be objective and scientific. And when we look at the UK here, this is showing that in the cohort of over 90s, 94% are vaccinated. If you come down to the cohort 45 to 49, it's 81% vaccinated. But even in the cohort of 12 to 15 years old, they're 50% vaccinated and 10% vaccinated in the cohort 5 to 11 years old. Now, one of the things that had stood out to me early in the pandemic was the fact that children don't usually get severe COVID 19. Now, this may be changing depending on the variant, but across the board, even in Singapore, actually, when we looked at the figures coming out with regards to 250,000 children, zero died. There were some hospitalizations, but again, zero died. And so when we think about the younger cohorts and healthy people who have no comorbidities, the use or the intervention can certainly cause problems. Remember, the statistics coming out of the USA highlighted that 97.4% of all the deaths in that subset of the population that they looked at least one comorbidity. That's a very important point, and it highlights the selection that we should use when we're thinking about it. My greatest concern at the moment is that because we are not appropriately using the scientific tools we have, we could be damaging the future of a very valuable form of vaccination through damaging the public's understanding and trust in it. Really, really important that we get this right at this time. We cannot afford to handle science like an elephant in the room that we ignore. We must always be willing to look at the hard questions, analyze them, and make sure that this is important. At the end of the day, I'll take you back to the important slide, which is this one. We need to understand why excess mortality is rising in that group. I'll make it full screen, 0 to 14 years old across Europe, as well as the 15 to 44-year-olds. We need to break down those numbers. We need to be able to see what are they dying from. And this is why I separate the lockdown groups, because the lockdown groups, we know probably the older cohorts, mental health conditions are more influenced in terms of risk factors. Younger cohorts tend not to be. So then what we need to do is clarify what the association with those deaths are using statistical models. It should be relatively simple. Well, not simple. It will be complex, but in the context of looking retrospectively at all the deaths, to separate them into cohorts of vaccinated, unvaccinated, comorbidities for the younger groups. That's how we'll get clarification. That's how we'll get answers. What we have to do as a society is not be afraid to ask the hard questions. And this is one of those times where we must ask hard questions in order to get good answers. So I hope you found that valuable. I apologize that the first recording wasn't as clear. I hope I've gotten it right this time. Have a great evening, and I'll look forward to sharing some more information with you in the near future.